Greetings, health practitioners, doctors, nurses, pharmacists, paramedics, all those who practice in medicine. I am Chris and I'm an experienced medical specialist of over 40 years experience who's practiced in almost every area of medicine, now retired. This podcast is not to give advice about your medical treatment. If you have any concerns about that, you should raise it with your doctor. Today, we begin a podcast or a series of podcasts which are devoted to this book, Hippocrasy, written by two authors who are distinguished academics in the medical profession. Note that it's spelled H-I-P-P-O and not H-Y-P. The reason it's spelt that way is that it refers to Hippocrates the physician and also the Hippocratic Oath. But, curiously enough, the authors also are interested in hypocrisy, spelled H-Y-P, which doctors will demonstrate when they don't practice according to their oath. Hypocrisy is saying one thing and doing another. Hippocrates of the title was a Greek physician who flourished on the island of Kos in the 5th century before the Common Era. Very little is known about him, and much that is written on him was written by other people. Although Hippocrates is described as the father of medicine, nothing is known either about his successes or about his treatments. And indeed, the ancient Egyptians were as good as the Greeks when it came to medicine. Hippocrates was supposed to have written the Hippocratic Oath, which is a pledge that doctors take before they practice medicine. But Hippocrates never wrote this oath, and there are several versions of it. The first lie is that doctors are required to take this before they practice. But as I said, most of them haven't, and I didn't take it until I was in 30 years of practice, and I did it on the island of Kos, where Hippocrates comes from. Although the oath enshrines a number of important principles, the most important one of all is to do no harm to the patient. This is known by the Latin term primum non nocere, first do no harm. The authors of this book are suggesting that doctors, by practicing the way they are, may be harming the patient. So let us recap. The title of this book, Hippocrasy, is based on three things: Hippocrates, the Greek physician, the Hippocratic Oath, and hypocrisy, spelled H-Y-P, which is saying one thing and doing another. The specialists who have written this book come from inside the profession. This is not an attack from the outside of the profession. It's important to emphasise that. When we're doing these podcasts, we will give quite a number of examples. To illustrate, discuss medicines. Most medicines, it will surprise you to know, are either ineffective, harmful, or too expensive. The problem isn't with the medicines themselves, many of which have saved a lot of lives. The problem is with the way doctors prescribe these medicines, which is ineffective. And it's important for me to give you an example of this. If you go to the doctor and he, with a common cold, and he prescribes you an antibiotic, that is an example of him giving you a medication which is not effective, and therefore he's lying to you if he says that you should take it, because actually giving antibiotics when they're not required is harmful to the environment and harmful to the patient. Doctors don't tend to think scientifically, and they tend to resist scientific innovation. Best example of this is bleeding. Bleeding of patients to treat conditions was obviously very harmful. but it was very difficult for the profession to abandon this. And in fact, Marcel Proust, in his book, describes how at the time of the death of his grandmother, leeches were still used at the turn of last century. There are also problems in prescribing medications for mental health. Most mental health medications are not prescribed correctly by doctors, are either prescribed for conditions that don't require them, or they're overused for some conditions. And this has become one of the biggest problems in the treatment of mental health. The difficulty these doctors have with the behaviour of doctors practising incorrectly according to their oath not only applies to medications, it also applies to laboratory tests and x-rays, many of which are not necessary or lead to over-treatment. To give you the simplest example of this, when you go to your doctor and he takes your blood pressure, the blood pressure consists of two readings. The upper reading is called the systolic, which should be below 130, and the diastolic, which should be below 90. But often when patients go to the doctor and they're presented with this blood pressure of 130/90, the doctor will prescribe a medication, but that's not the correct treatment. The correct treatment is to monitor the patient to see that this is not an isolated reading, and also to make lifestyle changes that improve the blood pressure before a medication is given. The American Cardiac Association recommended that people be treated at levels of 130/90. But this wasn't correct, because that would have meant that a third of the entire population of the United States would be given blood pressure medication. The problem also applies to screening for cancer. Confusion over screening for prostate cancer led to the deaths of thousands of men. The authors of the book also consider orthopaedic surgeries, some of which are ineffective and some of which are harmful. We'll consider these as we go through the podcasts. But the lesson is this: just because a doctor doesn't know your diagnosis, or just because he doesn't know how to treat it, does not entitle him to lie to you.